My name is Heather Strupp, and I chose to read Safe Patients, Smart Hospitals. This book outlines the perspectives and challenges nurses face to keep patients safe daily. Throughout this book, the authors share details of projects implemented through teamwork and incremental change. Instead of developing a universal measure, they stress the importance of each hospital building a team to diagnose and then treat its unique culture and organizational problems. Culture in healthcare organization is key to success of new processes, improved quality metrics, and delivery of high quality care, making it an essential element in meeting organizational goals. Organizations are changing to empower staff to help with problem solving and making decisions about what they are or aren't going to do. This influences the care patients receive and their patient experience. Quality of care is a vital component for achieving high productivity levels within healthcare organizations and enhances the probability of achieving expected health outcomes. If they are involved in decision making, meaning the staff, the nurses, nursing assistants, and involved in problem solving, they will have more ownership and feel that us as leaders are listening to them. This improves staff satisfaction that cascades into many other aspects of healthcare. Establishing a culture of continuous improvement and empowering our staff to develop process solutions that are robust, patient-centered, and lean in design will create a more collaborative culture. The author shares several examples of how culture and the systems it influences and creates can have more significant influences on patient outcomes. Doctors are the most trusted profession in healthcare by many and are trained that they make the final decision, but they have very few classes on collaboration and teamwork. Once that change in culture happens and the views of the team are involved in problem solving, a patient will have improved outcomes. Development of a checklist was initiated to ensure that the team would follow it when completing tasks, such as central line insertion, to prevent infections. A case was discussed about a healthy young woman who went to surgery for a laparoscopic surgery. The author explained how a surgeon's ego got in the way of this patient's outcome. The surgeon believed that there was no way the patient was practically dying after the perfect surgery he had performed. It came to the point where the on-call surgeon was open to the author's suggestions and took the patient to surgery. It was found that the rod used during the first initial surgery had punctured the pancreas and had been having fluid was leaking into her abdomen, which caused the infection. Due to this medical error, the patient ended up being hospitalized for 6 months and in rehab for over a year. The checklist would never be successful in this organization if the culture had not changed. The purpose of CUSP, what is the Comprehensive Unit-Based Safety Program, is to team build and improve the culture on the unit with the hope that it would create a platform when change is accepted. Culture needs to change, and we need to learn how to work better as a team. Without a system in place like CUSP to improve communication and teamwork in a stressful environment, the type of behavior of not speaking up or being timid or scared could potentially harm our patients and their outcomes. CUSP has a goal to enhance communication, collaboration, and culture on the individual units so that they can focus on improving patient outcomes, which is our ultimate goal as healthcare providers. CUSP was a way to empower nurses, the frontline staff, to see what safety concerns were present on the unit so that they could solve them to improve the safety of our patients, ideally creating a culture of positivity and hope. As leaders, we can mentor staff and help groom employees to advance in the organization. We can help them critically think about how to improve their daily workflow. The issues the author mentioned are things that the frontline staff recognized as patient safety concerns. The more leadership empowers our staff to discuss opportunities for improvement, the safer the environment is for our patients and for our staff. The team would feel their voice was heard and supported by the organization and administration. Balfour et al. Of 2017 agrees with the author that empowering staff can positively affect safety and throughput and are complementary to the patient-centered clinical goals in a healthcare setting. Ohana is a Hawaiian word for family that essentially means you won't be left behind. This is an impactful term for leaders who have an essential role in making care safer and to accept that responsibility. Because without our support, CUSP cannot be successful for our teams. Nurses, as we know, are the ones that care for our patients and spend the most time with them every day. Therefore, they have a tremendous amount of knowledge about what is happening on our units. When given the voice to discuss problems and we empower them to solve them, patient safety is improved and it cascades to other initiatives. All registered nurses act as change agents to drive processes and policy, and they leverage technology to prove better ways to make our patients safe. Nurses are imperative to developing new practices, improving quality of care, and advancing healthcare technology. According to Linden and Rowley of 2014, there is a positive effect on individual nurse empowerment by raising the clinical nurse's positive perception at the workplace. This, in turn, has a motivating effect, and it raises overall job satisfaction and patient safety. Standardization has many benefits, and this is something that was developed through the CUSP model. So it improves clarity because a standard process will eliminate waste and the need for guesswork or extra searching. It improves quality because work is done in a defined, optimized way developed by the staff. It promotes productivity because employees won't need to ask around or comb through documentation to get the answers they need. It also improves patient satisfaction because every patient receives evidence-based care and high-quality care. Elimination of variability creates consistency of steps and sequences in staff. This delivers tremendous care to our patients. Bringing new staff up to speed with everything they need to learn, standardization spells out in steps in a clear language that is visual, providing a continuous reference. Standardization enables our teams in the organization to avoid unnecessary risk to our patients. This is due to the process and steps being visible and understood. There is no need to attempt shortcuts because the new processes have been evaluated and safe and are more efficient. Finally, standardization facilitates continuous improvement by establishing a baseline of performance. Our teams are then able to work together to evaluate all variables prior to determining if a change is needed to the standardization. Having a standardized workflow is a structure that ensures positive results by promoting creativity and productivity of our team in a meaningful and measurable way. The author started with one problem, central line infections, which are associated with 30,000 to 62,000 deaths a year in the United States. On a sheet of paper, the author listed the steps needed to insert central line infections to insert central lines to avoid infections. They were the things that every doctor, every nurse knew that needed to be done, but were not reliably carried out each and every time. He initiated this at Johns Hopkins in Maryland and actually changed the infection rate from 11% to 0 after the implementation of the checklist. Standardization, Borders and Purdy define as involving all staff in creating best practices and implementing those best practices the same way everywhere and at all times. Any processes, procedures, work areas, and other settings should be standardized whenever possible so that all employees doing the same job are working with the same tools and to the same standard. This book gave me, as a leader, a better perspective of how critical all roles are in advancing safe care and how simple it can be. And just utilizing the 3 themes identified in my presentation, which is communication, standardization, and improving culture, we as leaders can change how our organizations can empower our staff to better serve our patients and make a safer environment. Thank you.